Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. Later, we're going to hear how Lexington will be observing Dr. Martin Luther King Jr. Day. Chester Grundy, a longtime leader in the civil rights movement in Lexington, will be here, along with Carl Nathy from the University of Kentucky. They join us later on Kentucky Newsmakers. But first, emergency room physician and WKYT contributor Dr. Ryan Stanton is here with us. The flu has hit Kentucky hard. There have been at least 5 fatalities in Lexington at this point, apparently 36 statewide, including 2 children. Some Kentucky hospitals have put in visitor restrictions. Ephraim McDowell Regional Medical Center in Danville declared itself at capacity at one point. Many Kentuckians have been very sick with the flu. We'll discuss that with Dr. Stanton and a few other medical issues, including how health insurance coverage is sometimes leaving people sick in another way when they get their bills. We appreciate you coming in, Dr. Stanton.
Thanks a lot.
And welcome. It is proving to be a tough weather situation this weekend, obviously in lots of ways. Given the events that we have out there and some of the snow, what precautions do you remind people of, say for instance, if they start trying to clear the snow or shovel the snow?
Yeah, so the biggest things we're of course going to see are falls. With this type of weather, the ice, the snow, we see a lot of falls. So last freezing event, we had at one point on one shift 15 consults to orthopedics for surgical needs for fractures associated with falls in the ice. But not only that, you know, now we're getting to the point where people are going to start trying to get outside. They're going to start trying to do things, and unfortunately, gravity is still well intact and will fight you every bit of the way, and actually potential for cause significant injuries. Now, you mentioned the other big risk, which is trying to clear the snow. When you have events like this where you have rain to sleet to ice to snow, it's really heavy, and people get out there and they try to shovel, they try to do things. And when we're evaluating people for heart-related conditions, we do something called a stress test. Now, stress test, controlled environment, basically putting your heart to work, making it do everything it can, and seeing if it has any struggling. Whether it's on EKG, you start having chest pain, shortness of breath, whatever it may be. Basically, shoveling snow is like a stress test, but without a hospital or cardiologist involved. And so you're out there against weight, against resistance, getting that heart rate up, straining physically, lifting that weight, and it puts a lot of strain on the heart, especially in populations where you may be at higher risk, folks with cardiovascular disease, hypertension, hyperlipidemia, diabetes, things like that. And so we have a lot of people across the country in snow events that will end up having cardiac issues, complications, and end up in our emergency rooms.
And simply because they don't know their limitations, right?
Many people who do this aren't very active, aren't active like a lot of kids or like they may have used to, and they're getting out there for the first time, really starting to strain themselves. And yeah, unfortunately, a lot of these heart disease issues will flare up when somebody really strains themselves.
Before the weather hit like it has, we had asked you to come by and talk about the flu. This really has turned into a rough season around the country. We know new numbers, 36 people have died of the flu in Kentucky. That includes 2 children, several confirmed fatalities in Lexington, a lot of sickness going around Kentucky. Why is this?
Well, our flu hit really big right around the 20th, 21st of December. We actually keep a tracking board of flu cases, and we were seeing 2, 3, 4 cases per day. And starting at that point, we immediately jumped up to 15, 20, up to 25, 30 cases per day. And that's those that we've actually tested and confirmed. The screening test we have in the emergency department only picks up about 70%, and we don't always actually even test people for the flu. So that's just actually a sampling, probably much larger numbers. And so what we're seeing is numbers similar to what we had in 2014 and 15, a very early season. The vaccine is not great in terms of completely preventing the flu like we've had in the past. And so the flu season hit earlier, about a month earlier than what we see in a year where we have really good coverage with the flu vaccine. And so the numbers are huge. Every hospital is full, and we're averaging probably 25 to 30 patients more per day in our emergency department than we would see on any given average daily volume.
What do we mean by the flu shot is not as effective this year? It didn't hit the mark on the strain?
The strain will shift a little bit. So the way ours is predicted is what we've seen in the past and also what they've seen in the southern hemisphere during their winter, which is our summer, so Australia being the big one. And the prediction from that is a guess on which are going to be the most common strains. H1N1 is always in it now, and H3N2 strain, which is the big one we're seeing is in there as well. They cover 4. It's called a quadrivalent vaccine, covering 4 different strains. This year, they thought that H3N2 had shifted just enough that it wasn't going to cover very well. Australia, they predicted it was going to be about 10%. What we're seeing numbers here in the U.S. is probably about 30% effective at preventing the flu.
Yeah.
But even with that, it significantly decreases the severity, and the other strains are much more typical, which is about 50 to 60% protective. So not absolute by any stretch of the imagination, but the best we can expect on a vaccine is about 50 to 60%.
And still the CDC and Kentucky health officials say get that flu shot.
Oh, absolutely. Even the cases I've seen. So we had a family that came in. A few of them had the vaccine. A couple had not. They all 5 got the flu. The few that got the vaccine were better within about 3 days and never really were incapacitated. The other 2 had the typical wipe you out flu for a week, feeling really terrible. And most folks, I think some forget how bad the flu makes you feel until you have it. And it is probably one of the worst recurring infectious diseases we see on an annual basis in the emergency department that really makes people feel bad. And then we have the highest risk populations. Those are the ones that are highest risk of complication and death, being over age 65 is number 1, 50 to 64 is number 2, and then under age 4 is number 3. But honestly, it can hit anybody, and we can't tell who that's going to be.
Mm-hmm. So we often hear that it is the older population and the very young, as you say. However, this year it seems to really be hitting people younger ages. We're hearing a lot of people 20s, 30s, 40s with the major flu.
And the flu is going to hit everybody.
Sure.
The highest risk of death is going to be at the ends of the spectrum, and with the H1N1 2009 and the years after that, it was very random throughout the age groups of who it impacted in terms of risk of complication and death. This is more typical, but the thing is, it can impact everybody. Many people have seen the story about the 21-year-old bodybuilder who passed away. He was perfectly healthy, succumbed to the flu. And also, us as people that would be considered healthy, we have the risk and potential to spread it to people who have higher risk. Cancer patients, the elderly, the very young, those that can't be vaccinated, immunocompromised patients. And so we have a lot of responsibility and ability to get the vaccine and help protect ourselves, but really more important than anything else is protect others.
In your opinion as a physician, do you have a responsibility to stay away from people if you have the flu?
You should, absolutely. I know people, the American way is to make it to work and tough through everything and to be there, but honestly all you're doing is exposing everybody to a big nasty illness. So if you've got the flu, honestly, if you've got that one or the GI illness that's going around right now, stay at home, recover, get better, and then head back to work. You're going to be more productive for your workplace and make it less likely you're going to get people sick.
Some hospitals put in visitor restrictions. We had also the report that Ephraim McDowell was near capacity with sick cases. But aren't some of those precautions make a lot of sense really for anybody?
They do.
Washing hands and using the sanitizer and so forth is emphasized.
And many of these things are made to reinforce that. You know, in the hospital they monitor us. If we wash our hands going into and out of the room, do we use personal protective equipment? But it's even more. If you walk into our ER right now, almost everybody's got on a yellow mask, protecting themselves, trying to protect others from the spread of the flu, washing their hands more often. So you need to do that. Wash the surfaces, your phone, keyboards, areas around the kitchen, doorknobs, things like that that can hold this the virus and allow it to spread among other folks. And this is, the whole purpose here in the hospitals. All of us are full. And here in Lexington, most of us run almost full all the time, is the fact that we just want to try to prevent that spread. We have so many flu cases in the hospital, in our emergency departments. Having folks in there not only can bring illness, but also has the opportunity to take illness with them, and we don't want that to happen. We want to try to kind of sequester it off. Time
frame for this, usually it starts to let up, what, late February, March?
It typically will be February, March. The 2014 and 15 really started early February, started to tail off. It really kind of what I call flamed itself out, just kind of rushed through everybody. Typically what we see is one spike, it kind of tails off a little bit, then a secondary spike as another strain comes through. And so hopefully that'll happen this year. The concern is with the vaccine susceptibility is that we may have a prolonged season as well. But we would expect significant drop by March.
Dr. Ryan Stanton is with us on Kentucky Newsmakers on WKYT. We're going to ask him about the opioid epidemic, what he sees in those emergency rooms, and we also have a little bit later a look ahead to Lexington's observance of MLK Day. We're back in a moment. Welcome back to WKYT's Kentucky Newsmakers. We're glad to have you with us. We're visiting with Dr. Ryan Stanton. He's an emergency room physician and does lots of other things. We're just an interesting fellow to talk to, and we thought you'd enjoy it here as we deal with this snowy weekend. And thanks again for coming in.
Well, thank you.
This opioid epidemic is tragic. Lives are lost or ruined, and families are torn apart by it. We know that. You see it firsthand. Narcan, of course, is the first defense that has saved a lot of people. How do you describe what you see in emergency rooms?
To say it's an epidemic is an understatement. I mean, most folks say, you know, we've seen this before with opioids, but even then, if you look at the graphs currently to what we're seeing now, especially here in Kentucky, West Virginia, basically Appalachian region in general, I mean, it's basically dwarfed and flattened out the curve of what we've seen in the past. So the numbers are astronomical that we're seeing. You know, here in Lexington, we've gone from $2,000 a year to basically $80,000 a year for our Narcan investment every year. And some folks, you know, I still hear that misunderstanding of you know, just let Darwin sort them out, just let them go. They're addicts, they're making a choice. But people have to understand that this is a brain disease. This is basically rewiring the brain, just as if I would go into your house and rewire the circuitry to where if I turn on this light switch that it would do something other than turn on the light you were wanting. And so, you know, addiction, until we understand it, until we can see that it's a disease and that we need to all be involved to help intervene. You know, interestingly, I couldn't have said this more than a few months ago, but I'm starting to see a little bit of a light at the tunnel. I'm starting to see that we're making progress. You know, we've got resources out there coming together, the state, the city, everybody's coming together, starting to understand this issue, and we're finally getting those things to help folks. And so we have a three-pronged approach that we have to have. Is one, how do we manage pain in hospitals and healthcare? And I think we're really making adjustments in that. My hospital system is completely reevaluating that to better treat pain and safer. Two, how do we prevent further addicts, future addicts, by being good stewards of opioids and education? And three, what do we do with our addicts and how do we get them recovered? You're
involved in a program called Empowering Communities, and that is just to get people connected to the resources that are
Absolutely.
available, right?
Get Help Lex is a wonderful website and contact out there. It's not just for Lexington, it actually is for the entire state. It plugs you in based on your demographics, your resources, your location, and tells you what's available. And that's what we need. We rescue them from overdoses and then try to get them help.
It's very encouraging to hear somebody like you say that you may see some light.
I'm starting to see a little bit. Sunrise is coming.
Big challenge ahead, as we know. Miranda Combs recently did a story about how a large insurance carrier is refusing coverage on some emergency room visits. It comes as a surprise, certainly to the patient, a couple of weeks after they've been there, and it came as a surprise to you.
Yeah, absolutely. So Anthem said they were doing it since 2015. We saw nothing until mid-2017. They say it's to help keep non-emergent cases out of the emergency room, but unfortunately, the cases I've heard of, even from the story that we had here, I've had several people reach out to me, 3 abdominal pains, a chest pain, severe headaches. I mean, things that I would personally, if I had this, I would go into the emergency room. And the insurance company is saying, you're ruling out the emergency, and so we're not going to pay for it because you should never have gone. So we're expecting them to do what we do in the emergency room at home as the lay public.
In the response to us, they said they cited the itchy eyes and ingrown toenails as among some of the things that people go to ER for.
I mean, there are some non-emergent cases that come to the emergency room, and that's what they like to say is the things they're refusing. But you tell that to the folks who have their abdominal pains, chest pains, and headaches, you know, potential true emergencies that are coming in. And my concern is people are going to see this. They're going to get afraid. They're going to have a bill that comes in for a family member. They're going to have some sort of significant symptom. They're going to delay or not go to the hospital, not go seek help, and things are going to get bad, and people are going to get hurt, and people are going to die.
Would you say it is putting too much on the layperson to make a judgment call sometimes about whether they need to go to ER?
I've got now 15 years in medicine as a physician. And I wouldn't put that pressure on me to make that decision at home, much less somebody who has no medical training and no medical education. This is ridiculous that they're trying to expect that our folks are going to do this, and it's going to put folks' lives at risk. I mean, we just had this article came out recently about a woman who calls their insurance company. They say, no, everything's fine, just treat it with whatever over the counter. And she was a pregnant woman and died of a pulmonary embolism at home. And these are the things, and unfortunately, it's not about helping the patients. It's not about helping the healthcare system. It's all about profits.
Kentucky is an unhealthy state. We have about a minute left, and we know that. What are the areas that we can just do better in, and that people can take some responsibility for themselves and make our population healthier?
Well, it's a new year, so this is a great time for resolutions. Resolutions to being healthier, eating healthier, being more active. Prevention is where our healthcare system needs to go. We need to try to prevent disease rather than react to it, which is the way our system is designed. So trying to prevent illness, to prevent disease, simple things such as, helping your diet out, exercising. You don't even have to go and be an Olympian. That's fine. Just exercise some, be more active, and now just do everything you can to make wise decisions. And the best thing around here is cut out smoking. Biggest modifiable risk factor that we have here in Kentucky.
Dr. Ryan Stanton, thanks for coming.
Thank you.
Really appreciate it. Hope you'll stay with us now on Kentucky Newsmakers. Look ahead to MLK Day, which is coming up, of course, Monday. We're back on Kentucky Newsmakers on WKYT in a moment. Welcome back to Kentucky Newsmakers on WKYT. Tomorrow is a federal holiday, and Lexington will hold its annual celebration to honor the legacy of Dr. Martin Luther King Jr. Joining me now are Chester Grundy, longtime co-chair of the Martin Luther King Jr. Holiday Planning Committee, and Carl Nathey of the University of Kentucky, also involved with that committee. Gentlemen, thank you for coming in. We really do appreciate it.
Thank you, Bill.
Chester, you have quite a legacy on the Lexington civil rights scene. You helped found the Black Student Union at UK, and as I understand it, you were a student at the university at the time of Martin Luther King's assassination.
Yes, I was. I was a junior in April 1968, and I look back on that time now. That was really a powerful, kind of transformative moment for all of us, but particularly for Black students at UK. Aside from the devastating feeling of the loss of Dr. King, it really did make us look at our situation much closer. And, that kind of examination moved us to begin to initiate some efforts on our campus to try to improve, our own experience, but mainly for the experience of Black students who we knew would come after us.
And some on the faculty were very supportive of
yes,
those efforts early.
Yeah, there were people on faculty and on staff who assisted us with some of those efforts, helped us develop a 6-week summer program that helped us identify good prospective recruits and give them kind of pre-season preparation for a freshman year at UK.
How different were those times compared to now?
Well, very different, but then in some ways very similar, because we learned that change isn't uniform, just doesn't go straight up in one direction and things get better and better. That, there are always moments when the things that we thought we had secured are at risk again, and that's one of the values that we have in doing this holiday. That is not symbolic, that it really is about trying to keep in mind values and commitments that are very critical to us being a progressive, democratic society.
You said something very powerful to me before we started this, and that was that it was a struggle, but you wouldn't change having lived through that.
No. I look at my own life, so much of what I have been involved in since the woman I married, the profession I chose, it's all related to my experience as a student. And even though, it was very challenging at times, it was still very gratifying in terms of the kind of personal growth that one can experience in such a dynamic period of history.
Carl, you have been working with this committee. You've gotten to know Chester and so many others who've been long involved in this. This has been a lot of learning for you, hasn't it?
It has indeed. Some people question over the years, why do we need to have African American studies or African American history and teach that? But there's things that, frankly, I never learned in school. I grew up in the Northeast, so pretty supposedly open-minded and getting all sides of the story. But there's things that I've learned since living here in Kentucky more than 30 years and getting involved with the Martin Luther King Holiday Planning Committee that I've learned in terms of the context. I've learned more about Jim Crow, the separate but equal. When you talk about some of the things and people wonder, well, there's statues that are being moved and this and that. And, well, you got to put it in the context. These weren't necessarily put up right after the Civil War. They were put up in the early part of the 20th century, and many people that were behind these things, yes, maybe they were respecting their heritage on their side of things in the Civil War and people that fought in it, and they have due respect for that. But what they're bringing out with these monuments is reinforcing that there's a stereotype that if we have to grudgingly accept separate but equal, you're going to be there and he's going to be over on this side, and never shall the twain meet, if you will.
This has been a year of charged emotions, the last year or so. In Chester, we all saw the Confederate statues removed from what was once a major slave market in Lexington. In your view, how important was that?
I think it's really significant. You know, and I would say to those who claim that this is trying to destroy history, it's simply not destroying history. It is putting history in its proper context. You know, the fact of what we choose to celebrate in the public square is very important. It says who we are, what we value, and there's no effort on the part of anybody who wanted the removal of those statues. The intent was not to destroy anything, but the question has to be asked, is it proper to celebrate and to elevate in the public square images of subjugation, images of human bondage? I mean, those images can't be disassociated from a war that was based on slavery.
You remember some of the earliest MLK celebrations in Lexington. You were involved in
Yes.
helping organize some of those. Tremendous increase in participation since those days, right?
Oh, yes. You know, the first efforts really amounted to a small candlelit march, 50 people, small program, small modest program in Memorial Hall. And over the years, thanks to the leadership of people like William Parker, former chancellor, late former chancellor at UK, it's evolved and it's grown to be in a partnership with the city of Lexington. This wonderful marriage between the university and the city, and now it draws participation from nonprofits, from churches, from businesses, clubs, social justice groups. So it is really, truly a community tradition.
Carl, share with us what is going to be going on, all of the events on Monday, tomorrow, as this program is airing, Martin Luther King Day in Lexington.
Well, let's start off with the Downtown March, Downtown Freedom March, which honors the legacy of Dr. Martin Luther King Jr., and that'll start at 10 o'clock from alongside Heritage Hall. Groups and individuals can start lining up and forming there at 9 a.m. Now, after the Downtown March, which is roughly maybe a little over a mile walk through the streets of downtown, comes back to Heritage Hall at 11 o'clock. We'll have the program inside. The keynote speaker is Tim Wise, a noted author and educator. And we're also going to have the music of Charles Little and Sandra Sissy Williams. They're going to be part of that program. There's going to be a small community resource fair that's going to happen right after that. Then after that breaks up, and that's usually about an 80 to 90 minute program in Heritage Hall. People have a little bit of time in between, and then 2 o'clock, Kentucky Theater. There's an absolutely free showing, no admission, thanks to One World Films, of the movie Hidden Figures, which documents the key role that some African-American female mathematicians played in the early days of the space age, and getting some of the well-deserved credit now, but that movie helped bring that to light. And then 5 o'clock at the Lyric Theater, again, free admission, a play that's entitled The Meeting. which is based on what would have happened if Malcolm X and Dr. Martin Luther King Jr. had sat down to discuss things. And Chester knows that story better than I do, which never really happened.
Right. But let me add one thing to this schedule. Directly following the commemorative program, we're going to offer a resource fair in the ballroom adjacent to Heritage Hall. And that's our effort to try to make this moment real, to give people opportunity to volunteer, nonprofit groups, youth organizations, so that you know, this is not just a moment of inspiration, that you know, people can make the commitment in the moment.
You also told me that speakers have come here from all around the country, and they have told you that Lexington really is a model in how to commemorate Martin Luther King Day.
Yes, we've been told that by people like Danny Glover and Ossie Davis, the late Ossie Davis. So that's very gratifying. But I think their meaning was that we really do try very consistently to make this relevant and to give people an opportunity to like translate their inspiration into some good work, good, positive, community-based work.
All are welcome, not just from Lexington, but from throughout Kentucky.
We get people
And
come
beyond.
And beyond, right.
at Campbellsville, all over, and all events, the march, the program, the movie showing, the play, all are free. Doesn't cost you a penny.
All right, and we're well aware that other communities will have commemorations and celebrations as well. Thank you so much for coming
you're so
back.
welcome.
Really appreciate that.
Thank you, Bill.
And thank you for joining us for this edition of Kentucky Newsmakers. We'll see you bright and early this week on WKYT This Morning, and we hope you make it a good week ahead.